What's the goal of brushing your teeth? We do this, we're supposed to do this every day, right? But do we even know what we're doing when we do this? What's the deal with toothbrushing? What's the deal with brushing your teeth? Why do we brush our teeth? What's the point? So yeah, what's the goal of brushing your teeth? Basically to remove food debris, but more importantly, a lot of people don't realize this, to get rid of dental plaque. We all have lots of bacteria in our mouths all the time. The bacteria settles on our teeth and forms a little gang called dental plaque. Plaque turns carbohydrates and sugar into acid, and that acid breaks down and destroys our teeth. It takes about 24 hours, one full day, for dental plaque to form on our teeth after we remove it. So if you're brushing your teeth correctly and thoroughly at least once a day, preferably at night, then you're minimizing your risk for cavities. If you brush twice a day, even better. You might not get every single spot every time you brush. If you brush twice, better chance you're going to get everything all the way clean. Brushing gently with a soft bristle toothbrush is an effective way to remove dental plaque. You don't want to brush with a medium or coarse, hard toothbrush. You're more likely to strip your teeth down over time and cause gum tissue recession this way. What about electric toothbrushes? Are electric toothbrushes better than manual toothbrushes? For some patients, sure, but they aren't necessary to do a good job. Don't feel like you have to have an electric toothbrush. Young kids or elderly patients who don't have a high level of manual dexterity to use a toothbrush may find it a lot easier to use an electric toothbrush. Patients who have a tendency to brush their teeth too hard may also benefit from an electric toothbrush. Some of those brushes, they have a sensor that will, buzz at you if you apply too much pressure, calm down, whatever. But we have plenty of studies that show that a standard manual toothbrush, just where you just use the old power of your own hand, standard manual toothbrush will remove plaque just as well as an electric toothbrush when used properly. Some of it just comes down to personal preference. What does toothpaste do anyway? What's the point of toothpaste? If I can say that right. The point of brushing your teeth is to get plaque off the teeth. You can get all the plaque off your teeth using a toothbrush without any toothpaste on it. So what does toothpaste even do then? Why are we using toothpaste on our toothbrushes? What's the point? So reason number one, you might consider using toothpaste. Fluoride. A lot of people on the internet will try to scare you and tell you that fluoride is dangerous. As long as you're using your toothpaste or mouthwash with fluoride in it correctly, you really have nothing to worry about. It's not dangerous. Now if you have one of these my strange addiction issues and you're eating your toothpaste or something, yeah, that's a problem. Stop doing that. That's very toxic. Duh. All right, so why use fluoride? One of the number one enemies of teeth is acid. Acid breaks teeth down. It causes cavities, it causes erosion of teeth, it makes our teeth ugly and not work so good, and also hurta, no fun, ouchie pain. Okay, teeth no likey, the acid. Fluoride bonds to our teeth and helps repair acid damage. It also makes our teeth more resistant to acid damage in the future. Teeth with fluoride bonded to them will not break down as easily when exposed to acid. That's good. Reason number two to consider using toothpaste: reducing tooth sensitivity. If you have teeth that are sensitive to cold or to brushing, you may benefit from an anti-sensitivity toothpaste. There are two active ingredients in toothpaste that can help reduce tooth sensitivity. Number one, potassium nitrate, and number two, stannous fluoride. So if you have sensitive teeth, look for one of these ingredients when selecting a toothpaste. Also, you'll need to use this anti-sensitivity toothpaste for several weeks, twice a day, before you'll notice an improvement in your sensitivity. And if you stop using the toothpaste, then your sensitivity is likely to return. So you do have to keep using it. Another question floating around on the internet a lot these days: are more expensive toothpaste that don't contain fluoride worth it? Are those better? No. I've seen other dentists online recommending non-fluoride toothpaste that contain hydroxyapatite. You could use these if you want. They're not going to hurt you, but they have not been shown to be more effective than a regular fluoride toothpaste. If you use an appropriate amount of fluoride toothpaste, a rice-sized grain for young kids between age 2 and 3, and a pea-sized dab of toothpaste for everyone else, you're not going to have any problems from fluoride toothpaste. The Journal of the American Dental Association published a study that tested toothpastes on teeth in a laboratory setting for effectiveness in repairing teeth, and the results of that study, the fluoride toothpaste was better than 2 out of the 4 and equal to the 4th, and the 4th toothpaste is much more expensive. So, don't feel obligated to buy more expensive toothpastes with ingredients like beta tricalcium phosphate, casein phosphopeptide, stabilized amorphous calcium phosphate nanocomplexes, nanohydroxyapatite. Fancy names, but the most important thing is to just brush your teeth consistently each day, especially at night. If you do that, the toothpaste you use isn't going to matter that much. A lot of people are curious about whitening toothpaste. Should you use a whitening toothpaste? You can if you want, but whitening toothpaste is more abrasive. You can end up damaging your teeth and gums this way if you're not careful. Whitening toothpaste only removes surface stains on the teeth, and that can encourage patients to scrub their teeth a little too hard. A better way to whiten your teeth, in my opinion, is to use a whitening gel containing carbamide peroxide or hydrogen peroxide. I have other videos on TikTok and YouTube that explain how to use those most effectively. It was trendy for a while to have these charcoal toothpastes on the market. Are charcoal toothpaste useful to whiten your teeth? Not really. It's a gimmick. We don't have any evidence that charcoal toothpastes whiten your teeth any better or differently than other toothpastes. The more effective way to whiten your teeth is by using either a carbamide peroxide or hydrogen peroxide gel. I have other videos on YouTube and TikTok that explain how to use those most effectively and how to adapt them to your individual needs. So you can check those out if you want.